Well, Melbourne's students might be back in the classroom, but their struggles from lockdown have followed them. Medical experts say the major psychological and emotional stresses beginning in Melbourne's 7-month lockdown have not disappeared as restrictions have eased. In fact, in some cases, they have been exacerbated with a return to school and social settings. Dr. Stacey Harris is a general practitioner in the Melbourne suburb of Camberwell. She joined a number of other GP colleagues who wrote to the Premier demanding urgent easing of the recent lockdown, and she joins me now. Dr. Harris, thank you as always for your time. I love having you on the show because you're at the coalface of a lot of the stuff we only ever really hear about from experts at a high level or out of reports. You reported back then in the middle of the lockdown, you saw a huge increase in young people with mental health concerns, some as young as 12, which I found horrifying. But I'm sorry to hear that the influx hasn't eased as the restrictions have lifted. Help us understand, why is that?
The lockdown was too long. It's no more simple than that. It was too long for these kids. It was unnecessary. It just was too long. The whole thing about kids being resilient is true, but not for that long. It was abnormal. It was too long, and kids are fearful, and parents too, of going into lockdown again, because we went into lockdown for the right reasons, yes, but then it just went on, and it was too long. It was abnormal what happened to these kids.
So give us some examples of how this inability to cope manifests. What are the signs we should be looking for in children?
So lots of anxiety surrounding going back, and I think, teachers have done a great job. They've been thrown in the deep end, but I don't know whether they're fully aware or not that kids are struggling and they're pushing themselves forward, or some are, to just keep going, but deep down they don't know how to socialise normally. The teachers have to do report writing and assessments, and they're behind. There's no doubt about that. I can't speak for every child. I'm sure there's children who have advanced, but there's plenty who are behind and will be behind. And so it manifests in anxiety and not sleeping at night, school refusal, restricting food, behaviours like that I'm seeing even more.
I'm even knowing adults, Stacey, who have found after this, really long lockdown, almost like they're agoraphobic in getting back out there in social settings. They don't mind doing it, once every few days, but they can't really come at the idea that they're out there every day like they used to be. And if adults are feeling like that, and they've got, some sort of capacity probably to understand some of the reasons why, you've got to think kids would be struggling.
Definitely. And I'm seeing adults, I'm seeing elderly as well. But yes, you're absolutely right. And kids, just have really struggled. And look, I thought actually that opening, I knew it wouldn't be the answer, but I thought things would ease up in terms of what my workload is, and it hasn't. It's the same, if not worse. I'm seeing more people come out that were in lockdown, and as there's struggling, the kids are, and even young adults in university, they're coming out now saying they don't know what, they're describing anxiety symptoms, but they don't know what it is. And so having to find them help and sometimes prescribing, it goes on and on. The problems have not gone away because things have opened.
You say you've had an uptake in mothers with young babies and toddlers also struggling mentally. Yes,
so it's gone up in my community, in the patients I'm seeing. A lot of dear mums who have been on their own with their husbands working, and so they've had these toddlers and babies, and now they can go out. Now they're petrified, and so they're coming to me, and I'm having to try to get them into again to see appropriate people and counsel them and help them in the fear. It's non-stop talking about it, which we do expect, but not in this volume, and not with these poor young mums who deserve to feel normal, as we all do, but they're just not. They're not. A lot are anxious even to go to the playground. And I'm having to tell them, you don't have to be wiping down the playground equipment before your kid plays. You don't have to worry if a kid sneezes, it's more likely hay fever. The fear that has been instilled in everyone across the board because of what's being portrayed throughout lockdown, we're paying the price now. There's too many people fearful. even though things are open.
I've got to ask you before we go, did you ever get a response back from that letter you wrote to the Premier?
No. And I'm disappointed. I sent that also to the CMO. I sent that to Public Operations. I never got a reply, even though I resent it. And as you say, I don't like to use words, but I am at the coalface. Most GPs were at the coalface and still are. And to not get a response is nothing but disappointing from a leadership point of view. You might be able to tell I'm angry, I'm upset. The problems have been huge and it's taken its toll. And there's so many people out there that still need help. And to not get a response now, or still even back then, and his excuse was he gets lots of letters. Well, I'm sorry. I wasn't a business making a letter, which to me has been devastating. I'm not dismissing the businesses, that's been cruel, but I was pleading with the government to help these young kids and nothing. So that mistake cannot be done again. And those held responsible, as you have put out there with the Royal Commission, with the quarantine bungle, that can't happen again. People responsible who did the wrong thing have to be held responsible, because that's the reason we're in such a lockdown.
You keep up the fight, Stacey Harris.
Yeah,
and I'll keep up the
fight. You do too, Peter. Thank you. Thanks.
All right. Thank you for your time.